Hey, welcome back to Next Third, Best Third. I'm David Fenwick, founder and host, and I'm joined in studio today by Kevin Gates, my friend, my brother. I just love this guy. And today we're going to be talking, Kevin's going to be talking about kind of the wave of health in America and how it's changing. And you're qualified to do this because tell our viewers who you are.
Well, I'm a physical medicine and rehabilitation doctor. I'm the vice chair of the department in Temple at Baylor Scott & White. And, it's just one of those things that you spend so much time training to do this that you just get exposed to so many different things over time, and you start to recognize when things kind of change a little bit in an environment. And there's just been things over the past couple of years that started to notice have become more prominent, not only inside of patients' lives and what they're concerned about, but also how it's being addressed and other things that are out there. There's just more knowledge about it now. And sometimes it falls outside of what you typically find inside of a normal healthcare system, but there's a lot going on.
I love that about you because we've talked quite a bit how, you're fully ingrained, you're engaged. I mean, you've got this great career, and yet you realize that there's things that I think you said before of some sacred cows that, medicine has long honored, and those are starting to kind of fall apart, right?
A little bit, yeah. Man, there are so many amazing people inside of healthcare who I don't know that there would be, maybe there's some, but I don't know that anyone would have any overt wish to do something that's not going to be helpful for a patient. I don't think there's ill will there. And so as we talk about stuff, the things that I'm around are so humbling to get to see what patients are going through.
Yeah.
To get to see what they're willing to bring in front of somebody else to say, this is what it is. And then to know that there's a doctor or a nurse practitioner or a PA or someone, a nurse, standing on the other side saying, well, we're going to work on this.
Yeah.
It's incredibly humbling. And the amount of skills that people acquire over time are just, and like you said, this is being in the middle of it and still standing there looking at colleagues going like, how in the world do you do this?
Right.
And how do you deal with that? And it's really, it's an amazing thing. At the same time, we're doing things the way that we are because, in my opinion, because it's based on what we've understood for things to be the way they are, because of circumstances that either gave rise to the situation the patient's dealing with, or it's just kind of how we've done it, and that's what's accepted. There's this concept inside of practicing medicine, does it meet the standard of care? That's in my opinion, super important concept to maintain fidelity with. I did the thing, this thing happened, that's what we expected. Mm-hmm. Okay, so that at least gives you some foundation or bearing on what to do next.
Yeah.
And I think that's what most of us are doing. Unfortunately, sometimes I think there's a temptation to abdicate a role that you could potentially play as a doctor, a role that is meant for, but what else is there? Mm-hmm. Instead of saying, all of these responses are still good. Instead of saying, I don't know, 100% acceptable. If you don't, you don't. That's okay. Right. I say it all the time. Yeah. Saying, let's get some extra help by referring you to someone else who might know, whether it's in my specialty or not. Or saying, well, what are you willing to do to look into this further? All of those things are great. However, that last one of, what are you willing to look into with me? What level of trust do you have in me to work with you on finding maybe an alternative solution to this?
Right.
Especially when the other conventional things haven't worked. Or if there are other restraints that are preventing you from being able to do that. And that's something I run into a lot. And some of that has to do with the type of specialty that I'm in. I still explain to family all the time, like what I do. they get it now, but it's taken years. I mean, I still have to tell patients. Most of the time, patients come into our specialty going like, I don't know why I'm here. I don't know what y'all do. And we are in physical medicine and rehab. It's a mix of orthopedics without the surgery part, neurology without a lot of the heavy duty medication management, but do a lot of the same diagnostic things, internal medicine at the same time. And we mostly treat patients who've had strokes, brain injuries, spinal cord injuries, amputations, neuromuscular diseases like ALS, Guillain-Barré syndrome, these sort of things. The whole purpose of what we do, and honestly, if you asked any doctor, what does a PM&R doctor do? Most of them would say back pain. Okay, yes, absolutely, 100%. We see a lot of patients with back pain too. All of this is meant to, and our approach is meant to restore function to improve somebody's quality of life. That's what we're told from the day we get into residency and get going, which I had a wonderful residency here in Austin. And knowing that that's what we're setting out with, over time, it started to feel like there's got to be something, I've got to have other options. And because it started to feel defeating. So I had some experiences that kind of led to where I'm at now, of this awakening and an awareness of there's other stuff going on out there right now that we can offer patients. And I think an atmosphere in healthcare is changing.
So it's interesting because so many of our subscribers and followers, they're so diverse. We've got guys in their 30s, we've got guys in their 80s, we've got guys who are grossly obese, we've got people who've got chronic pain, we've got people who are super fit. It's this whole thing, and one of the pillars is our health. It's our physical health that we want to address. And yet I see these guys so often, especially the ones who are they've got some physical limitations. Back, knee, joint. This is right up in your alley. The hardest thing for them to do, Kevin, is it's hard for them to find a place of hope and a place to start to get healthy.
It's so hard. Just call it what it is. It is difficult. There's the environment that we're in, what other people believe and what other people tell you is possible shapes so much of what you're willing to do, or even what you're aware of as a possibility to start.
Right.
It's crazy. So I think it's Francis Frangipan that said this about if there's a part of your life that doesn't glisten with hope, you're believing a lie about that aspect. And usually it's coming from some type of fear or something like that.
Right.
Hope is such a big deal. And man, it's so humbling to be in a room with a patient and just see them carry all of these things emotionally, mentally, all of that stuff, and be so devoid of hope. I have plenty of patients who come in and say, I know this isn't going to get better, but I just thought I'd come in. I don't know.
Right.
Like a Hail Mary kind of thing. Like, boy, I hope. They don't hope. They just got their feet there. And sometimes that's kind of what it takes. Is you just take that step out to just go see, but being met with someone who says, you don't have, that's okay. Let's develop that. Like, I see it there. And let's find out how we're going to do that.
So for our listeners, Kevin is my primary physician, and I remember when I first went to meet with you at your hospital in Temple, at your clinic, and I experienced firsthand how truly, and I love this about you, is how you made me feel seen. You listened, and in that, I knew that my journey was significant to you, and you were like wanting to partner with me. And I think that's one of the key things when we talk about health, because we get people, I've had guests who are full bore, holistic naturopaths. I've got people who do all sorts of different kinds of training, physical training and what have you. But one thing that I consistently see that means so much is when they're really seeing and listening. And that compassion comes out. So
100%. And I think the pillars that you guys talk about a lot on the podcast are, I see them as being extremely close in proximity to each other. and what you believe about a situation going into it just shapes so much about what you're open to, what you see as possibility. But I mean, that's true for me, even as a doctor. I mean, like, part of medical school is indoctrination, and it's not even necessarily in a negative sense. It's, hey, one day, my program director asked, first day of residency, what are you called when you graduate from medical school, or from residency, when you graduate from residency? And everyone's saying doctor. He's like, nope, you're a doctor when you're done with medical school. What do they call you? Go around. Nobody knows. And at the end of it, he says, they call you colleague all of a sudden. So now you're this person who at the end of, 4 years of residency, after 4 years of medical school, after 4 years of undergrad, you're now expected to act like your colleagues who've been doing this for 30, 40 years.
That's interesting.
That part to me is important because it started in medical school, but much more so in residency, of a mind renewal process inside of a system of, see, when you're presented with this pattern, this is how you respond. This is what we expect to happen. So here's the more straight line, the most straight line you could make to operate and to do it well. And that's part of that standardized process, and that's good. What it does not necessarily bring into naturally is, are you renewing your mind with the truth outside of facts?
That is so good.
Right. And so when patients come in and there's just devoid of, this is never getting better, I will always have pain, this is a thing, and I don't think you're going to fix this. It's being worn like a piece of clothing.
Yeah.
So it's an identity thing. And that's where these pillars, I think, fit together so closely.
I had a friend of mine, we were talking some time ago, and we were talking about disease and what have you, and she basically said this. She goes, you've got to change your language. It's not, I have arthritis.
Right.
I'm dealing with arthritis.
Right.
I don't have back pain. I'm dealing with back pain. And I know some of you are going to listen to this and say, well, that's crazy. It's not.
Yeah.
Because that's part of renewing your mind, and it is the truth.
Right.
The fact is, you might be dealing with severe back pain.
Yeah.
But the truth is, you're dealing with it, looking for a solution,
100%.
Looking for a cure, and you have to believe there is one.
Right, 100%. And that belief that there is a cure out there, I believe that there are doctors who, for whatever reason right now, are hungry to be able to practice that way, who might not feel like that's within their license. I can't say that personally for anybody, but I do get that sense. And I could say that, man, if I've felt that, somebody else has to have felt the same thing. And that's where I've started to feel this shift in atmosphere of, like, I wonder, wouldn't it be cool if, that kind of thing of, there were more people starting to go, you know what? I know this has been your experience so far, but I believe this isn't going to be a part of your life forever. And if there's anyone listening to this that's been my patient, I usually say 3 of the same things is true for everybody. I don't believe this is going to be a part of your life forever. I have hope that this is going to go away. And, if you feel like at any point you want to change directions, we'll do it together, because I'm here to help you navigate through this. And part of what Marshall Ullman said one time, he was like, yeah, that navigator thing is cool. Navigators are still kind of lost as they go along, but they have the trust of whoever's following them that they're going to figure it out as you go.
That's good.
Which is true for us doctors. And I think admitting that, I don't know, but I'm here with you while we go through it.
That's so good.
And being committed to them and saying, like, hey, we are going to work on this together. That takes a lot for a doctor to do, though. Personally, because, oh no, I'm going to get their hopes up. I've told them now. I just got to a point where I had a feeling, but I didn't have words for it. And recently I listened to an interview with a pastor whose wife recently died from cancer. And now it's like my new line. And it's, I'm not willing to prepare for loss when I've asked the Lord for gain.
Wow.
And I was like, yeah, that's exactly right. And now it's a part of, like, what I say to patients. So, and it's like, and we're going to pray right now before I even examine you that we're going to have gain in this situation. I can't tell you how many times that happens where all of a sudden the whole atmosphere in the room changes. And there's new things that are afforded to us at that point, with just the shift in mindset for both of us. And it's a practice to get to that place. it's a novel one for many patients to have somebody come in and say, oh no, we're going to work on this till this goes away, instead of, well, here's what I do.
That's right.
And
I'm going to prescribe this. We're going to do this, and that's simple as that. Wow. It's interesting to me because so much of this is tied to faith,
right?
But so much of this is, hope is a real thing. Mm-hmm. We talk about the 5 pillars of next third, best third, right? And it's your thought life, it's your physical health, your emotional well-being, your relationships, and all that entails. And then the things that what we call warring against your identity, right? It's the lies we believe, it's the doubts, it's the shame, the guilt, all these things that we can carry into adulthood. And yet hope in each one of those plays such an important part.
Oh, it's huge. It's huge. And it's something that I think you can make a decision to have.
Yeah.
And that takes, that decision takes the same amount of energy to say yes or no to. And that's not, saying, so suck it up and just do the right thing. I get it, but I think one of the most relevant stories in the Bible to this and what this podcast is about, and this is just personally for me, is Caleb. In Numbers, it starts talking about, Moses sent out one from each of the tribes. Hey, go look in Canaan, tell me what you find. 10 of them come back going, oh, no, we're not doing that.
Right.
2 of them, Joshua and Caleb, come back and say, what are we doing? Let's go.
Right.
Let's go. And that's what I think in modern speak, what Caleb would have been saying is like, let's go. Let's do it now.
And it's interesting in that story, for those who are not familiar with it, but in that story is the 10 spies or the 12 spies go out. All 12 came back saying basically the same thing.
That's exactly right. They all saw the same.
They look like we look like, there's giants in the land. The land is rich with fruit and milk and honey. It's everything that we want, but 10 of them were like, we can't do this.
That's right. 100%. And Caleb, and later on in Joshua, it talks about how he had a different faith. Mm-hmm. And his story turned out a little bit different because of his perspective and the faith that he had in the Lord, to know that, hey, he's going to take care of us. He's promised this to us.
Right.
And that was part of his identity is I am this person who has faith in this, and I know that this is going to be given to us, and I'm not worried about that.
It's interesting. Faith is just like so much in life. It's a two-sided coin, right? Mm-hmm. You can have faith in a good outcome, right? You can have faith that God is good and that things are going to work out good, but you could also have faith that you're going to die.
100%.
You can have faith that you're sick and it's going to get worse.
Oh my gosh. Like 2 years ago, this is not how I've always done this.
Yeah.
Okay. I was chief of the normie resident doctors, and I was doing what everyone was doing. Yeah. Something happened to me about 2 years ago where I was in a hospital. I was in the children's hospital, actually. I remember most of what happened. I was in two rooms, these little girls who had been in a car accident. I didn't know they were related because most people come in on trauma names. And I finished seeing the second girl. They couldn't speak because they had brain injuries. And I walked out and I said, hey, are they related? And she said, oh, yeah. And we just found out that their mom just died over in the other hospital.
Wow.
I lost it. I was a big mess on the floor outside of their room, sitting down. I called Erin, my wife, and I said, I can't keep driving on I-35. I can't do this anymore. It's too much. What if something happened to me? And that was the beginning of me allowing a stronghold in my mind to be built that allowed the enemy to start wandering around and whispering to me, see, this could be you too. In fact, I bet it will be. Zero basis for that. Mm-hmm. But I started not necessarily partnering with, but boy, that voice got louder and louder to where I even had to change like the type of patients I would go see in the hospital. And it was really, really rough. So to your point, that faith, like you could have faith in either one of those things. And that fear I allowed in my life for a time. Yeah. And finally, after I had started praying with patients and praying for patients, I got super disappointed. I was like, what are you doing? Like, I'm here praying for these people who are hurting. What about even for me, for my family? I'm praying for all of this stuff. Why am I not seeing these things happen? He doesn't usually answer that one.
Yeah.
And then Finally, when I kind of realized that, I said, okay, fine. Being mad and obstinate, I said, fine. Then if it's not going to happen, what do you want me to do with the disappointment then? What am I supposed to do with that? And not in an audible voice, but almost like it was spoken in my mind. He said, I'll take that and handle that too. Now all of a sudden it fits with kind of this, I'm not willing to prepare for loss thing, because the Lord's going to take care of you in your current moment and after. So to your point, when people in church circles and everything start walking around saying, oh, we're praying for healing and all these things, and people aren't seeing it. Okay, I can't explain that. And I pray for patients all of the time. And I have seen people healed right then. And even when I was just walking into the room, stuff happened before I even got in there. And they're like, I don't know what happened, but my pain's gone. I was like, man, can I tell you I was praying for you outside? And so that kind of stuff happens. And when it doesn't, we still come to the Lord because he still loves us and he'll still take care of us in that moment too. So all of a sudden there's a freedom to put yourself out there with hope, because I'm not afraid of that disappointment anymore, or nearly as much as I used to be.
Yeah.
Right. And so that's still something I'm working on.
Yeah.
But, yeah.
We have a mutual friend who's probably, in my opinion, one of the smartest human beings in the world, and very successful scientist, research scientist. And he said something very recently to a group of men, and I shared it with you earlier, but I want to say it now, is he said, science and medicine deal in facts. They're facts. This is the situation. This is the diagnosis. This is what we're working with.
Yeah.
He said, but there is truth.
Right.
And truth is greater than facts. Yeah. And he says, and what we want to work towards is truth.
Right.
Discovering the truth. Of course, we're Christians, we believe truth is found in Jesus, right, in a person. But even if you're not a believer, to have that desire to go beyond the facts,
right,
and discover what truth really is for you in that situation.
100%. And that allows this very cool partnership between medicine and the spiritual healing that comes through someone who loves you so much that they want you to be healed. There's no reconciliation that has to happen there. They exist in tandem together. And one made the other one possible. Yeah. And so that's why I still prescribe medicine. Right. Right. Now, I am confident that 15 years from now, we'll look back and go, man, can you believe we were giving people that? Right. Right. Because that happens all the time.
Because facts change.
That's exactly right. And so now we're talking about creating an environment or an atmosphere of discernment to know what to do for individuals, because we're centering on truth. And that's fueled by hope that there is better for doctors, nurses, patients, their families. There is better. There is better out there, and it doesn't have to stay this way. And it's a fight that I think is currently being waged with the tools that we feel like we have. Yeah. I think that there are still things out there where we would say, you're looking for your car keys under the one street light. But there's a whole parking lot. And if there's not a number that we could measure, to say that if there's not a number that we could measure the effect of that, then we aren't going to do it. That's where it doesn't sit well with me when you see other patients benefiting from things like that. And I think that comes from, on a provider side, I'll say, I've made decisions out of fear that if we did this thing, what if you had something happen? No kidding. What if you had something good happen? And that's a scary place to be, but that's where I think things are kind of going, of not only going off of what conventional medicine right now is saying, what I would consider to be mainstream medicine. All of this is based on the Flexner report. Or do you know what any of this? No. Man, this is so weird. So there's no tinfoil hat in the room.
So we're nerding out a little bit.
Okay. So, well, it's not that much. No. It's a little bit more of, you could dive deep on stuff like this. But the Flexner report was written in the early 1900s by the effort there was to standardize medical care. Because there were some quacks, right? Just like there are now, I got it. And the desire, I think, was, or what the stated desire was to standardize medicine so that we can actually figure out when we're moving the needle. unfortunately, the funding behind that was the Carnegie Foundation for Advancement of Teaching. The Rockefellers involved in this too. Both of those families had enormous impact on great things that happened in our country. I got it. However, the standardization pointed more toward petroleum products. Mm-hmm. And it was a masterclass in vertical integration where, hey, we got a problem. Let's train people to give the solution that we own and we could sell.
Right.
So that's part of what it is. And now accreditation is still based on that for medical schools. And it's what it is. And I think now there will be a breakaway from mainstream medicine and what I think now is more of what is being called functional medicine, where it's more of a holistic approach where you're really looking at basically the pillars that you talk about on this podcast and how important each of those things are. I mean, in the functional medicine training that I've even gone through, you're going back to like your birth story and stuff, which a doctor looks at that and goes like, okay, like get out the incense and the whatever, like this is getting weird. Like you can't possibly blah, 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 tie something to this. But you can't deny it when stuff starts making a difference for people. Mm-hmm. It's just, it's an enormous effort to do that. And for doctors to break away from the current way of doing things, you just don't have time in a day.
I find it interesting because so often when you go to get your physicals and things like that, they want to know that your family medical history.
Right.
So you want to know your family medical history, but you're not tying at all your family emotional history.
No,
your family psychological history, your family relational history, and all that works in conjunction for your physical well-being. 100%.
Yeah. What do you believe about yourself?
Yeah.
Is this possible for this to be different?
Yeah.
You know, that's where that family mental health or belief history and that kind of stuff. Mm-hmm. I'm not talking about, we could talk about Masons and all that, whatever.
No.
But we're talking more about like, hey, was there psychological stress in your household when you were a kid that then shaped how you viewed what could happen in your life that is now coloring the belief that you have about the treatment you could potentially receive to then be healed? Yeah, that's an important exercise to go through.
Oh, yeah.
As opposed to what happens now a lot of times is I'll have a conversation with someone and they go, well, my mom had diabetes too. Not type 1, which is, okay, maybe there'd be some link there, but my mom had diabetes. It runs in our family. But not in a genetic sense necessarily, you know, but like, okay, I got it.
Lifestyle.
That's right. What you're telling me is there were a set of circumstances that gave rise to this, and I understand what you're saying. But that's not always I'm not calling anybody unintelligent or not having the knowledge or whatever. All I'm saying is it's misattributed. Mm-hmm. And that misattribution, I think, is a place where there's a lot of ground to make up for people to actually see a huge change in their lives.
Yeah, that's so good.
Because otherwise you're accepting it as like, no, this is who I am.
That's right.
It's actually who my family was. It's who I'm going to continue to be.
That's right.
That's not true.
Yeah, well, you're coming into agreement and empowering something that isn't truth.
Right.
And it really, in those circumstances, yeah, it might be a fact that there's a lot of diabetes in your family. Sure. That's a fact.
Right.
But it's not truth that you're doomed to that.
Correct. Man, there's weird stuff going out there right now. This guy, Jason Fung, who is a nephrologist, and now he was helping people on dialysis, basically from diabetes most of the time. Kidney failure. Reversing diabetes, not by genetic treatment, right? But pretty severe fasting protocols and things like that, where people are coming off their insulin and it's like, okay, like there are physiologic ways to do this and overcome that. However, to get the buy-in from someone that's possible, you have to overcome the belief that this is what's causing this or this is where this is coming from. Mm-hmm. And that's a conversation that's well worth having.
Yeah.
And it might not happen in a 30-minute visit or a 15-minute visit. Man, family practice doctors are fighting a war, and they are massively outnumbered. I mean, they're being forced to see people every 15 minutes and treat the thing as clearly as we can because I got someone else in the next room. To be able to slow that process down, I mean, I don't have the solution to that right now, but that's kind of what I'm thinking about more about how can we coordinate an effort here where it's not just one person shouldering all of that. But that's a massive ask for a doctor in that set of circumstances.
It seems to me that we're talking a medical transaction versus health care.
Correct. Oh, 100%. Yeah. And that's, that's even in the language that we use about, during the visit, these are the things that happen. And we even write our notes to that, evaluation and management coding. How many problems did you address? What's the transaction there? Not what wins did the patient have during this time or so. And I know you could get kind of woo-woo about that stuff and like, oh, it makes a difference what you write down. I think it does. But to your point, it is very transactional. And I think the current set of circumstances in the way it's currently run inside of a clinic is built for that. And so it's an environment that is made for, it's structured that way. And it's a hard thing to overcome. And that's where I think, there's an opportunity for atmospheres outside of a clinic, in a conventional clinic, and how it's currently running, to really make some ground in that area.
I so admire your take and your dream to see where this is going to go. When with Next Third, Best Third, one of the things that I've seen so often, Kevin, and this is why I love doing this, it's when I see men, and again, we have 30% of our followers are women, but to see the guys that I work with personally and to see them take one of those pillars, so often I tell them, take one, you know, change your thought life, what you're thinking, or I have a dear friend, I've shared this story before where he was really struggling. He had sold his business. His identity, he was struggling with that. His marriage was falling apart. He was in his late 60s, drinking too much. His health was just going down in a spiral. And he decided that he was going to embrace relationships. And he started calling guys that he went to college with like 30, 40 years ago. And just starting to initiate relationships. Next thing you know, he's like calling me all the time saying, man, I just had an hour and a half phone call with this guy. I talked to him the other day. He's totally sober. He's playing golf again. He's outside, he's got hope. And it's because he just decided he was going to work on one thing. Well, now it's opened up. He's identified identity issues, right? His physical condition is being taken care of, his emotional well-being. So it all intertwines.
Oh, yeah. Big time. And where that entry point is, I mean, it's probably whichever one is the lowest barrier for you to do. Because you'll see it start toppling these other things over. I mean, like for patients that I see, if you're going to focus on some physical stuff to do, I mean, there's like a really close-knit set of things that you could do to get started on that doesn't have to be fancy. And we could get into, you got to buy this and that. You got to do these things. Man, turns out the 10,000 step thing, it's real. And I mean, 50% drop in overall all-cause mortality by walking 10,000 steps a day. Dang it. That's not what I wanted to hear. I don't get that. I mean, I'm in clinic, right? Walking 20 feet back and forth and finding the time. I got it. I'm a person too trying to get this figured out. It's stuff like that. Or if you're going to go lift weights, it's anything. This is how wide the range is for health, right? Anything between 5 and 30 reps. So long as you're going to fall within about 3 reps in reserve. It doesn't matter what the weight is. You can do anything between 5 and 30. If you keep lifting until you go, I probably got 3 more, stop. I'm talking, that turns into 20 minutes twice a week. That's not, and
Peter Attia, right? Dr. Peter Attia, love him. And he did research on, and of course now we know that they're calling Alzheimer's and type 3 diabetes. But he said that if you would just get that 10,000 steps, right? VO2 max, get your VO2 max up and keep it up. That the chances of you getting Alzheimer's drops to minuscule. And then he says, then the second thing is the weightlifting. And, it's like going, it's not that hard, but you just have to get some hope.
You do have to get some hope, and it's simple, but it's not easily implemented.
That's a
I think
better
a
way of
lot of
saying it.
times, right? I think what you're saying is still correct. Like, it's not hard to understand that concept. But it is a simple thing that seems in our current state of things to be difficult to implement.
Yeah.
And that sucks. Like, how did it get to a place to where it is like that?
Yeah.
You could come up with all kinds of, and maybe some of them I believe, I don't know, conspiracy theories about, oh, well, it's structured this way so that we all get unhealthy and blah, blah. I think now we have the knowledge and we have the opportunity to partner together to start making some of these things a little bit different and easier to access. Right. Part of understanding and knowing what it is at least gives you the opportunity to. There's all kinds of people out there doing all kinds of work on habits. Charles Duhigg, Angela Duckworth on grit. I mean, all kinds of things that you could look into to figure out how to stack habits and do little things where you're going off of cues and then your routine and then the reward you give yourself and that kind of stuff. There's all kinds of things out there and resources like Pete Aratia and Rhonda Patrick and all of these people who are really, I mean, man, talk about subject matter experts where they're really putting and compiling all of these things together. It is so out there for us to go and grab. Yeah. And to your point, though, it is simple, but seems more difficult to implement.
So this has been so good. I love this so much. I want to leave the listeners with something. And again, it's vast. There are diverse people out there. But if there's somebody who's listening who's, they're in the position where they're really kind of struggling, right? They're struggling either their diabetes, overweight, their chronic issues in their life. What would you leave them? What little nugget would you give them right now to maybe give them hope?
Yeah, you are loved beyond what you could even possibly understand. And you're more valuable. It was true for anybody listening to this, not just someone struggling. You're more valuable than you could possibly understand. Yeah. And you're worth somebody else helping you. And if you don't like how you feel right now, I would never tell you you're fine just how you are. It's okay to let go of that and change to do something different. Yeah. And you might be surprised what a small ask to someone in your circle would result in if you were to ask them for a hand. Yeah. Tons of people out there get lots of purpose out of helping. Hopefully that you do have someone in your life like that. And if it's a doctor or it's a family member, it does not matter. Someone is out there willing to help if you're willing to reach out to them. And it's simple, but can be difficult to do. But it's well worth it because you are. And so you have something to give to a lot of other people.
It's so good. I love that. And it's really important for all of our listeners, but especially men, to realize that real manhood, I say real manhood or masculinity, is being courageous enough to be vulnerable. Yeah. You know, I'm writing a book right now on the difference between aloneness, loneliness, and isolation. Three very different things, and yet a lot of times those words are interchanged. And isolation is a dangerous place. And there's what ends up happening is we buy into this thing going, nobody cares, or nobody will understand, or I'll be rejected, or I don't want to be vulnerable, and you start to isolate yourself. But the very thing we need is we need to be real, and we need to be open.
Yeah, because being isolated allows your mind to continue to be renewed with your past experience. Yeah. And that is not the truth. I guess that's the other thing I would say is that your past experience and the way things have been is not what's going to come from here. It doesn't have to be.
That's right.
Right. So renewing your mind with things outside of your own hope or not, your own belief about what is or isn't, and reaching out for something better. It's okay to accept that better thing, even if you don't necessarily believe right now that could be true. Yeah. It is well worth at least being open to that. And part of being open to that is being around other people who aren't in that same place that you are and being isolated.
Yeah, that's so good. That's so good. This has been great.
Yeah, it's awesome.
Thanks so much for being here. Thank you all for listening. And if you do me a favor, always ask, subscribe, like, comment, share, whatever you can do. I'd love to I had a goal to get to 1,000 subscribers by the end of August. We're like at 780, so we need a major push here in the next 2 weeks. But if you share this, we might get there, right?
Yeah.
I have hope that we're going to get
yeah,
there.
for sure.
So,
That's right.
all right. Thanks so much, Kevin.
Yeah, for sure.
See
This
you
is
next
great.
time.